Well, hello, Sound Advice, Hearing Friendly Business podcast listeners. It's Teresa. Today, we're going to have a special start for the new year with Dr. Geoffrey A. Smith. Here is just a little bit about Dr. Smith. For if I were going to go everything he's done in life, I'd be taking the entire time talking rather than us listening to all the valuable information that Dr. Smith has to tell us. And that is Dr. Smith as an MD. So we have all kinds of doctors out there. But Dr. Smith is a Harvard graduate who specializes in ear, nose, and throat medicine and was a well-respected, sharp hospital physician for how many years, Dr. Smith?
Over 40. I've been retired for almost 20 years.
Okay, so he was working there for over 40 years and retired for about 20. So, but he doesn't retire because when you hear the other things he does, he's a man that's always giving back to the world, you know? So Dr. Smith is somebody who came up with the procedure for swimmer's ear. And as you heard, as I heard, you were a surfer, were you?
Sure. Everybody in Southern California is a surfer.
I never had enough balance to stay on the board, so not everybody. Did you ever surf here in Carlsbad? That's where I'm recording from.
Oh, yes. Carlsbad, Wind and Sea, Rincon, up the coast, you name it.
Okay, you've done it all then. Yeah, my two favorite places are obviously Carlsbad and I love Wind and Sea. I was just down there yesterday, so it's a beautiful beach. So it's all right if you want to tell us more about how people can protect what hearing they have and your other views on what people need that already have hearing loss in public venue, because you've had hearing loss for how long?
Since the 1960s.
So you've experienced all kinds of changes, yeah. So what do you think that the people that don't have hearing loss, what they need to do to try to preserve theirs?
Well, that's easy. You want to avoid loud noise. You want to avoid certain medicines. You want to try not getting knocked out. I see a lot of professional football players still that have a hearing loss from the repeated concussions that they're getting. There are certain medicines. People are being smarter about noise exposure now than they used to be. Years ago, not very smart with it. Now, people I see, usually through their jobs, have been, at least for the last 20 or 30 years, much better protected.
Well, good. So I didn't know, I mean, I knew, but maybe some of our listeners didn't know that there are auto, and that stands for the word ear, right, Dr. Smith?
Oto, O-T-O.
OTO, but those are medicines that can actually damage your hearing. So what's your recommendation on that so people can avoid that? Because that's something that pretty much 100% avoidable, except if you have some sort of emergency and you need it for life-saving.
Well, there are infections that you really don't have a choice with. There are a lot of other medications that you do have a choice with. And there's also choices, personal choices you can make. I see a lot of individuals that have a high frequency hearing loss. And the most common three are the cigarette smokers. They lose a high frequency hearing. The uncontrolled, untreated high blood pressure, they have microvascular problems, easy to treat with baby aspirin and blood pressure medicines. Elevated cholesterol, so those three categories there are preventable. Some of the other ototoxic drugs are really high-powered drugs, and if you're sick enough to need them, it may be worth the risk of damaging some of your hearing. Some of the older ototoxic drugs like streptomycin have been replaced pretty much now. So they're no longer out there, and we're no longer seeing a large number of individuals that lost chunks of their hearing as a consequence of that particular antibiotic.
How about the Z-Pak?
Z-Pak is fine, and Z-Pak, when it's indicated, is fine.
Okay.
There's risk with almost any medicine. It's important that your doctor knows what they're doing. Most do. It's important that people see if they're going to be needing a prescription, that they see somebody that's actually trained in medicine and trained enough to know pros and cons, as well as side effects and potential complications from the medicine. That's becoming, incidentally, a problem nowadays because of what we call algorithm medicine.
Oh,
And algorithm medicine is treating a patient based on checking the boxes. So an individual will come and see, typically it's a nurse practitioner or a physician's assistant. There are other organizations that have been lobbying in California and other states to have the right to practice medicine without having a medical doctorate degree. Algorithm means comes with the sore throat. They will ask with the fever. If there is a fever, they'll check a box if there's a fever. They will ask if there's any other symptoms. They will check boxes, and they will get down to their algorithm that says, if this person who called in has this, this, and this, you give him this treatment, antibiotic or whatever treatment. And it might work 80% of the time, but you're putting perhaps 20% of the people that algorithm medicine is practiced upon at risk.
well, anytime I listen to you, I always learn something new. And even though I'm an RN, to be quite authentic, I've never even heard of this. So thank you for filling me in on that, and our listeners too. So it's important to see a medical doctor if you've got some sort of medical illness. And equally so, it's also important to see a doctor of audiology, an AUD, if you say you've got a hearing loss.
You know,
And
that really is important. You're absolutely correct. And the reason that's important is a lot of the MD medical doctors don't recognize hearing loss in their patients. It frequently is the wife of a patient that will complain that the husband is turning up the television, putting the words on the screen. But I'd say the majority of individuals with a hearing loss don't go to a doctor and say, I have a hearing loss. A big chunk, it's the wife that goes with them that complains. But an even larger chunk will go in and get a hearing test, either from freestanding or for some screening. And the way current Medicare law is, then they have to go through their general practitioner. The general practitioner has to send them to an ear, nose, and throat doctor. The ear, nose, and throat doctor has to send them to an audiologist, where they have the hearing test, and if needing the hearing aids, they get the hearing aids. What we've been trying to do legislatively is having a direct access of individuals having a hearing loss to audiology doctors, the AUDs, so that the individual, a Medicare patient that's hard of hearing, doesn't have to jump through 3 hoops to get a hearing test done. He's able to go directly to get the test done. And if the audiologist finds a medical condition, the audiologist refers to the ear, nose, and throat doctor to take care of the condition. Audiologists are trained well enough to do that. They don't need to have to wait until they get a referral through an ear doctor to do a hearing test on a patient. So there are political changes we're working on. They haven't come to fruition yet.
well, here's a offer to you. I happen to be on the government committee through the Carlsbad Chamber, and they're also involved with the U.S. Chamber, for businesses. But we also have advocates in there from all the government entities, here in Carlsbad region. So we might be able to put that bill through them because I have the capacity to offer that bill. because they're always looking for something new, and they know I'm all about hearing. So maybe when we're done, we'll email whatever that legislative bill is, and even you can present to them, or you can have me present to them, and you can critique me, whatever that bill is, and let's see where it goes. But I have personal connections with all of that, if that'll help you.
Happy to help with that. We work on a national and state level, and I work with representatives from each of the states
Okay.
on a meeting like what we're doing with the Zoom or telephone.
Right.
And that's once or twice a month with
Okay.
legislative issues. It's primarily being spearheaded by the politicians who are audiologists, and they put that bill forward.
Okay.
Pretty much every legislative session with different sponsors on it, and it's opposed by some groups as well. And so as long as there are people promoting an issue and other people opposing it, politicians get donations from both sides, and so they like to keep the issue going for as long as they can. Money's turned off once the donations stop coming in.
Yeah. Well, for somebody who's retired, you're certainly busy. I also heard that you're an archaeology expert as well. Can you tell us something about the different artifacts you have pertaining to hearing, including
Oh,
the
sure.
Olmec statue?
Well, the Olmec statue is interesting. That's a jade statue that was carved maybe 3,000 or 4,000 years ago by the Olmec culture or the La Venta culture in Mexico outside of Veracruz. And that feature has his hand to his ear where he is trying to hear. It's always been really, really important in the ancient cultures of the Americas to be able to hear their name called so they can answer and go on to a happy afterlife. There are people like in the Haina culture. This is an artifact, you can see that, from the Haina culture with a personality and a face. An individual was buried with this on the island, and this is Mayan royal, you can tell by the blue coloration doll, like this, so that when they awoke in the afterlife, their relative that looked and dressed like this would recognize them as a member of the family, and they would have a happy afterlife. It was also important for them when the gods called them to come to the afterlife that they could hear. So they would have individuals for them with their hearing aids, which are the ear spools, on. And these focused sound to the ears, and they made it so they could hear the gods call their name, so they could again go to the afterlife. This is Mayan, and this is 1,800 years old.
Wow.
Other cultures did the same thing. And this on the west coast of Mexico with an individual wearing his ear spools, which you can see right there.
I see it right there, yeah. And I will have this on Zoom for our listeners as well. How about that, the one from the Civil War, was it?
Oh, well, before we get to the Civil War, I'll show you about the ones that were actually worn by individuals. Jade was the most expensive material. So individuals would wear ear spools out of jade, and this is Mayan. So, and they would be buried with those so that they'd be able to hear their name called. In Peru, it would be made out of gold, and it would be in the ear again, so they would be able to hear. A few thousand years before that, the ancient Egyptians would be buried with 365 of these guys. These are called Ushaptis, and they are called the answerers.
Oh, the answerers?
The answerers, because when your name was called by Osiris, you had to go out and work the fields in Osiris's fields and harvest the crops, unless you had a person that would hear your name and answer for you. So the answerers became really important. Otherwise, you were there in the afterlife, toiling in the fields every day. you'd be buried with 360 of these. The hieroglyphs talk about, in this instance, presenting to Osiris, the shining one, and this is a General Patmocius. So this was a naval guy that had these buried with him. If they didn't have quite so much money, they would have smaller ones, but still 365. And they would also have to have for every 10 a supervisor to make sure they would do their work. So that was the Egyptian burials. People have had problems hearing historically for thousands of years. People figured out a long time ago, like the Olmec jade statue that you've shown people, with the cupping the ear and being able to hear better. During the Civil War, soldiers figured out that if you had a metal device put in your ear, sound waves would bounce off the metal and the higher frequency sound would be augmented because lower frequency sound would be dampened. So an individual with a high frequency hearing loss would wear this type of a hearing aid, and it came in various sizes for either worse hearing or just a matter of style, and it really does work. When I put these on a patient and say, listen to me talk with this in your ear, they're amazed how well it works. The problem is it's inconvenient to carry around. Hearing aids like I have on now are a lot easier to carry around. But this was developed by various companies. This was developed by the British. In fact, this type of a collapsible hearing aid was given to the English soldiers after the Second World War because England was out of money. They could make these, manufacture them, and provide them. They didn't have money to buy the hearing aids. In rural America, people made their own hearing aids. This is one made out of tin, and this was made in the middle 1800s, and it really works. You put it in your ear, you focus it at somebody, and you're actually able to hear well. This is another one that was more fancy with a little loop on it, so you could carry it around your neck.
Okay.
Awkward, but helpful. But ringing in the ears was a problem as well. It wasn't just not hearing. I've had ringing in my ears since I played for 2 years as a keyboard in a rock and roll group. It was called the Aardvarks. It was out of Colton, California when I was in high school. And although we weren't very good, we were very loud, and that damaged my hearing. But looking through historical things, you've heard of the house group?
Yes, I have.
And I did some of my training there. Actually, the house group had a predecessor called the I don't know if it's reverse or not. It says House of the Ear rather than House Group.
Just pull it back a little teeny bit so they can see it better. There we go. Yeah, that's got it. So.
And this had a way of treating the electrical noises of the ear. You'll notice the electrodes on the person's head.
Wow.
It didn't work. And I have seen hundreds of other devices. This is another one, an oxygenator, very fancy, very expensive, absolutely worthless device for hearing loss, as well as for ringing in the ears. But this was around, and it made people millionaires back in the late 1800s. Phony stuff still being done. This is a device made in China. You clip this with a clipper, you clip it onto the ear, it gives you an electrical shock. The shock hurts, but it's supposed to cure ringing in the ears and hearing loss. It's garbage.
Did it work?
No, it's garbage. Doesn't work, but the Chinese individual has sold, I'm sure, hundreds, if not thousands of these. There have been vitamin companies, lipoflavonoid, for instance, that's sold at Costco, which is guaranteed to cure ringing and sometimes hearing loss or your money back. Doesn't work. I regularly see individuals that have taken that. It's a group of vitamins. Ringing in the ears is caused by damage to your hearing. You have absent hearing on typically the higher frequencies that you have the ringing in the ears. So there's not a pill, a shot, an operation that will bring that back, because it's the absence of input to the brain from the inner ear that causes the ringing they have in their ears.
So if I were a new patient and I was sitting there and I told an ENT doctor, since that's one of the first steps they go through after the general practitioner, and he or she diagnoses me with tinnitus, then what kind of questions should I ask that doctor, about what I should do? Because I've heard that sound waves, like those little sound wave devices that they have, will distract the brain. And then I've also heard that ring stop help. I've also heard that hearing aids help. But what should that person that's new to tinnitus do so they don't go crazy, or, like William Shatner thought about ending his life because of his tinnitus was so bad?
Number one, you want to be able to tell your doctor what sound the ringing is.
Oh.
An audiologist has to be able to match the ringing you're hearing in your ears with frequencies on a hearing test. Number two, you want to be able to describe whether or not it's a constant noise or it's a noise that comes sometimes and doesn't come other times. And the reason for that is important. Whooshing type of noise people hear and come into the office and complain about is typically an individual that's hearing his blood circulation. They're hearing their pulse in their ears. That's not tinnitus from damage to hearing. Some of those individuals have high blood pressure undiagnosed. Some of those individuals have hardening of the blood vessels, and it needs to be treated and looked at. Other individuals will have problems such as dizziness, along with a low frequency sound in their ears. And they're having what's called hydrops or Meniere's syndrome. Some individuals, and that's again treatable and addressed with medicine. Years ago, we had surgical procedures at the house group that were used for that. I don't think many individuals are still doing the procedures we did in the 60s and the early 70s. Some individuals will have some other signs, numbness around the ears, and it turns out that they'll have a benign growth that can be attended to and treated and taken care of. So it's important that sort of thing be diagnosed. The higher frequency hearing, if it turns out to be frequency damage from loud noise or from cigarette smoking or for long-term pain medication use or for some of the antibiotics that were used, can be addressed with the newer hearing aids that have tinnitus masking technology incorporated into the circuitry. The newest type, and the one that I'm wearing currently, actually do a good job with processing the sounds at the different frequencies I am hearing. And they're then presenting those sounds to the brain. So my brain doesn't hear louder noise. It hears sounds, and the higher frequency processor is able to process those sounds into T's, PHs, and S's. And my brain is being retrained to recognize when those sounds are being heard versus when I have no hearing aid in and I have the ringing in the ears. Over the past several months, this new hearing aid has been the first of the bunch of different hearing aids that I've used that actually substantially reduced the ringing I have had in my ears. And now, if I concentrate, I can hear the ringing. I have 4,000 hertz frequency here, 6,000 hertz frequency here ringing, different frequency sounds. But if I concentrate and it's very quiet, I can hear the ringing. But before the tinnitus, the ringing in my ears was so loud, I would use the noise generators that had ocean sounds or bubbling brook sounds. Before that, I would have radio turned between stations, so I would hear white noise to drown it out so I could sleep. The dealers of the newer hearing aids have figured out, and they've done a good job for me, figuring out how to actually do something for the ringing in the ears. Before that time, usually it was charlatans and scam artists and individuals of that sort, in my opinion, that were providing treatment that didn't do a thing for the patient, sometimes damaged them. There was a patient I saw 2 weeks ago that had a large hole in his eardrum. That was from a doctor whom I'm sure was well-meaning, injecting cortisone through the eardrum into the middle ear to cure his ringing in the ears. It did nothing for the ringing in the ears. It left the patient with a big hole and a very unhappy patient with the doctor that put him through that. And I don't blame the patient at all.
So what kind of hearing aids are you wearing that releasing your symptoms from the tinnitus?
Well, the ones I got, the ones that actually work, I got from the hearing aid dealers here. It's Rancho Santa Fe Audiology, but they have offices where I see patients, which are in San Diego, Rancho Santa Fe, Santa Ana, Redlands, Upland, Corona, and across the street from Sharp Hospital in my old office. I only see patients 1 day a week, but I got those. They are manufactured by Oticon, which is a Danish company. And I can guarantee you that within the year, if they haven't already, other companies are going to be doing the same sort of modifications on their hearing aids. So they'll be providing similar products that actually help. It's really been a nice advancement. I'm very pleased with what's finally happened with the ringing in the ears I've had since 1964, 65.
Too much loud music.
That started it, but that wasn't all of it. I had Hong Kong flu, and the Hong Kong flu damaged my hearing at 6,000 hertz. But the rock and roll definitely was the start of my problems.
So what brand of the Oticon, what is it, or do you know?
Oticon is the manufacturer.
That's a manufacturer, but do you know how they have different types of hearing aids? So
They
which is
do.
this one that worked for you?
And the specific one I let the audiologist deal with, rather than me promoting one particular
okay. All right.
type. The one that works for me is an OPN, and it's the 2020 one, but individuals would need different programming, and that's the audiologist's job, not the ear doctor job.
Okay. Well, yesterday I was talking to someone and he told me, we talked about the stigma of hearing loss. And one of his thoughts, and he was just a customer service representative for SCAN, but what he said was he felt like the stigma of hearing loss was possibly caused because people made fun of people that used to wear the different horn type hearing aids that you showed me. And so my question is, do you think we can, because according to a Johns Hopkins study, it's 1 in 5 Americans that have hearing loss. So that's 20%. You take the extrapolation of the current population, that's 65 million Americans, plus or minus, so right around that number. And we only have 3.4 million people who are in wheelchairs and canes. So this disability of hearing loss, I'm wondering if people were to wear something like this symbol that you see here with the ear with the question mark, the hearing awareness symbol that people could wear on the store, put on the storefront to attract a customer like you and I into it, because they have hearing friendly spaces where the decibel level is down to 72, which means that we can hear with our hearing aids in. So therefore, it's not discriminatory noise, because that's what it is for me. And I've heard other people say that too. But do you think there's some way we can help with taking hearing loss out of the old-fashioned model? Because both you and I got it much earlier in life. Take it out of that, because there are 2.2 million veterans that came back from Afghanistan, so young people, with hearing loss. But they were to wear something like this to let other people know how to communicate with them better. And also they could wear it on their back, say if they're hiking, jogging, cycling, skiing, so that people could actually see hearing loss. And do you think that would help reduce the stigma? Or what do you think we can do about the stigma for hearing loss?
Well, you have some good ideas. More than that, there's things that individual places can do to help. Most of the people that have a hearing loss, particularly the military, you've mentioned, will have a high frequency hearing loss from loud noise. Their low frequency hearing is perfectly normal. It's the high frequency that they don't hear. High frequency sounds are T's, PHs, and Fs, those sort of consonant sounds. Low frequency sounds are the vowels, A, E, I, O, U, as well as background music or rumbling in restaurants of noises and so on. Individuals with a hearing loss will have an incredible problem being able to filter out the low frequency noise in order to understand the high frequency consonant sounds. Having a hearing friendly area in places such as restaurants, bars, and so on would facilitate greatly ability of the people with a hearing loss, with or without a hearing aid, to be able to understand conversation in those locations. So your ideas are a good idea.
Well, thank you for that. So this could be the new OMLIC symbol right here, the hearing loss awareness symbol. So I greatly appreciate your help on that. So let's see. That was extremely helpful. And how often, I mean, I know you're doing the legislative part now, which I didn't know about previously before I wrote these questions out. But how often do you think people should get their hearing tested? And what other side effects do you know about that people get if they just ignore getting their hearing tested and don't bother to wear those hearing aids?
Well, first thing is when their wife tells them that they need to get a hearing test, they need to be getting a hearing test. People through work now with OSHA and with hearing conservation programs are getting their hearing tested much more regularly. Hearing screening is being done in schools where it didn't used to be done regularly as well. There are some patients that I have seen that have come into the office and they have been told once a year they should get a hearing test because they had mild hearing loss on a hearing examination. Talking with these individuals, they don't work around loud noise. They did it one time. They haven't noticed any change in their hearing. All they're doing is wasting their money coming in once a year for hearing testing where there is little or no change. Most of these individuals, if not them, their family is smart enough to let them know if their hearing is dropping and they need to recheck their hearing. It's certainly true that a lot of hearing dealers will do free hearing tests whenever somebody makes an appointment, fills in a card, or walks through the door. But if I'm an individual and I know I have a hearing loss, I'm interested in monitoring if there's any change. But that's every 5 or so years. That's not coming in once a year. And that's certainly not taking advantage of the audiology and the hearing aid dealers, whose motivation to do the free hearing tests is not completely altruistic. They're interested in having customers for the hearing aids that they sell. And I'm wasting their time if I'm coming in once a year and patting myself on the back that my hearing hasn't changed over the past year. My family, me watching television, listening to the cell phones, I'm able to tell if my hearing's getting worse. And I'm smart enough to come in and have it checked when that's the case.
Well, not everybody is as smart as you are, Dr. Smith. So I've been irritated for a lot of years on why hearing or hearing loss in this particular case has not been given more attention, and why we have to pay so much for hearing aids, because they're just a medical prosthetic device. That's all they are. They're replacing a broken part of the body that's broken down. So I don't want to add any added cost to audiologists, of course. But I think that just like we get breast cancer screening and we get practical screening in October, and October is Hearing Awareness Month, then why can't we somehow or another promote people to get their hearing tested once a year? Because that way they kind of know where they're at on that. So just to get a baseline, because I heard in fact, actually it was a research article that I looked up, and I don't know whether it's Harvard or Johns Hopkins or University of Pennsylvania, but one of those three, that if you are supposed to wear hearing aids and you do not wear them, then your brain shrinks 1 centimeter per year. Have you
Yes.
heard anything about that?
Yes, that's nonsense.
Oh, it's nonsense. Okay, well, good to tell me.
However, you see, there can be a kernel of truth in nonsense.
Okay.
Your brain won't shrink because of that. However, if you have in a practice had people in their 80s that have had hearing losses since they were in their 40s or 50s, and you give them hearing aids, they don't tolerate it, because the hearing aids will do what a hearing aid is supposed to do, but the individual's brain no longer has the capacity to process those sounds. So they will either have pain or they'll have loud noise, but not words when they wear a hearing aid. We tell an individual when they begin to have a hearing loss, to monitor the hearing loss, because when they get to the point where they would benefit from it, if they are not wearing a hearing aid, what occurs with them is by putting off hearing aids for too many years, when they finally put them on, they won't work for them, they won't like them, they'll give them back to the dealer, they'll say, this doesn't help me at all. It's a real problem for them. That's not from the brain shrinking 1 centimeter a year. That's for the part of the brain that is used to process the various frequencies of sound no longer being needed and atrophying away. That doesn't mean the individuals are becoming Alzheimer's or dementia. It means that part of the brain is no longer functioning because that part of the brain wasn't used, wasn't needed for 10, 20, 30 years preceding getting the hearing aids.
So what I'm hearing you say is as soon as you know you need them, go ahead and get them as soon as you can. So.
But that's number one. And number two, at that point, it's important to follow up with the audiologist for 2 reasons. You need to keep the hearing aid properly adjusted. You need to have whatever changes and improvements in the circuitries be applied. You need to keep the device clean and operating normally and not having abnormalities. And also, they will be checking to ensure that an undiagnosed medical condition may be picked up on following visits that was missed on their first visit.
Well, our time is coming to a close, but I so appreciate all of your wisdom. And for someone, especially since you've experienced this for so many years, so you're part of the 20% with the hard of hearing, and I've known you off and on for at least 20 odd years, and I never even knew that you wore hearing aids. So you hit it well for me. So
well, they're hard to see. You can see behind the ear.
Yeah.
If I were wearing one of these, it would be an awful lot easier.
Right. Well, I would have been able to see that. Yes.
That you would.
So do you have anything else you want to share with our audience before we get ready to go? And is there anything you want us to help out with the American helping Asian children with hearing aids? I know you have a nonprofit that you and Dr. David Woodruff, AUD, which that's the Doctor of Audiology, that maybe some of our listeners may want to donate, and I'll put that in show notes so that they can have that availability to donate if they choose to.
Well, that's a good organization. It's the Americans Helping Asian Children. Dr. Bruce Johnson at Sharp-Rees-Steele, he is a gastroenterologist, but he was visiting Vietnam a good number of years ago and noticed they had no facility for the hard of hearing children. And he started that charity, and audiologists such as Dr. Woodruff were some of the first people that joined him and helped. Dr. Woodruff and I have helped set up clinics and services, not just in Vietnam, but also in Laos, in Cambodia, and in Myanmar, which is Burma, but it's the military government changed the name of that country to Myanmar. And that organization, Americans Helping Asian Children, has funded building, has funded training of individuals, has provided the hearing aids and the hearing aid education for now 2, maybe even 3 generations of children going through the facilities that the Americans Helping Asian Children charity has funded. All the doctors working and all the volunteers working on that worked for free. So if you look up charities, American Heart, Diabetes, or whatever organization, and you look to see what percentage of your donation actually goes to the individual with diabetes or the cancer research or so on, you'll find that in some organizations, it's a very small percentage. Every penny that goes into the Americans Helping Asian Children goes into the charity. We'll be buying the hearing aids, we'll be paying for the buildings. Nobody gets a salary in that. Nobody gets reimbursements in their travel expenses with that. That's all donated as well. So it's a 100% by donation organization. They don't market, so you probably would not have heard about it, but for talking with Dr. Woodruff or talking with me about it. It was, in fact, it still operates. And in addition to hearing problems and hearing aid access to the kids that otherwise would not get it, they do other things too. They build bridges and they help with the schools and they provide money for the building. But the primary focus has been the hard of hearing, children hard of hearing.
Well, that's wonderful that you're doing that great work to spread our American good health throughout the world too, because it's just something that I have always admired, both you and Dr. Woodruff. So I've enjoyed hearing from you, and I would love to have other listeners reach out. And do you have any place where listeners can reach out to you, or do you want them to go through me?
Actually, I do have a web page. I'm not really computer savvy. I think it's just under my name is Geoffrey A. Smith, MD, FACS. And it goes to, I think, a number of the articles that I've written, as well as the offices where we evaluate people that may need hearing aids. But that's on the internet. It's, I don't know any special way to get it other than introducing my name, then MD, and then FACS, Fellow in American College.
Well, what I'll do, listeners, is I will look that up for you and I'll put it in show notes. And then if I have any problem finding it, I'll reach back out to you. So there we go. So that way it'll be visual so people that have hard of hearing can see it for well. So that's all, folks, for today. Now here's Doug Sandler from Nice Guys in Business, and he believes in kindness that goes a long way.